Good afternoon, and thank you for joining us in celebrating our newest nursing graduates. My name is Dr. Deborah Williard, and I am the Dean of Nursing at Mercy College of Health Sciences. The pinning ceremony for nurses has been incredibly important as the pin itself represents the time and effort put into learning the materials, working in the clinicals, and serving our community. Our future nurses will be wearing this pin near their hearts so they always remember their time spent with us at Mercy College. But also remember why they have decided to become a nurse and to continue to uphold the servant's attitude for which patients and all patients that they encounter. To put it mildly, I am beyond proud of all of you, and I know you will do great things. That being said, let me now welcome Dr. Bo Bonner to give the reflection.
Thank you very much, and thank you all of you for letting us up here, every one of your professors and everybody involved at Mercy College, be a part of this evening, of the achievements that you guys have, of course, achieved yourself, but that we have a great share in. It is an honor to be a part of your day this evening where we celebrate you. And if you don't mind a quick reflection from starting with a quote from Sister Catherine Macaulay, the foundress of the Sisters of Mercy. She says, "How quietly the great God does all his mighty works. Darkness is spread over us, and light breaks in again, and there is no noise of drawing curtains or closing shutters." You see, you've worked hard all of this time in the relative darkness, as it were. It's hard for any of you, right, to convey the difficulty, the struggle, the hard work, the sweat and toil that has gone into getting to where you are today. Like seeds that are put in the ground that do their great work through the growing season of winter, people don't get to see all of that effort. But then spring comes along, and all of that quiet work now begins to bloom. And we are here to celebrate that blooming, that flourishing, you coming into the fullness of all that you've worked to be. And we want to say one more time, thank you for allowing us to be a part of celebrating this blooming. As has already been said, we're all very proud of you, and it's an honor to be a part of your coming to full fruition. We know very well that you will serve the people that your communities need. And one more time, we want to say thank you especially to your families for dedicating you all to this great service. So in closing, I'd like, if you're so inclined, to join me in a prayer of consecration that the Sisters of Mercy often pray. O compassionate God, look on us today with tenderness and give us the grace to walk on the path of mercy, marked out for those who follow you. May all we do today and every day reflect your merciful love. Amen. Thank you all very much.
Thank you, Dean Williard, for inviting me to speak at this special and very exciting occasion. My name is Jerry Babb, and I'd like to share some history and my thoughts, ever so brief, on what this ceremony is all about. The traditional pinning ceremony is a milestone in the life of a nurse. It gives a grand send-off for nurses, symbolizing your successful completion of the educational requirements. It marks your transition and official welcome into the professional world of nursing. My hope would be this ceremony promotes a sense of unity and belonging to the profession. This day can motivate you, stimulate your emotions, and prompt memories of learning experiences you'll never forget. A nursing pin is a prestigious memento for students who receive their degree in nursing. The history of the pin dates back to the 12th century. During the Crusades, the Maltese cross is a symbol of service and was worn by the knights who nursed and cared for the injured crusaders. Following the Crimean War in 1860, Florence Nightingale set the gold standard in nursing. She was the first to stress the importance of official nursing education and recognition of that education. The Nightingale School of Nursing at St. Thomas's Hospital in London designed and awarded a badge to nurses as they completed their nursing education. Eventually, the badge became a pin, and each school of nursing designed and awarded a customized pin to their graduates. In the United States, the first pin presented to a graduating class occurred at Bellevue Hospital in New York City in 1880. The nursing pin, usually made of gold or silver, is worn by nurses to identify the nursing school from which they graduated. Each school has their own unique design that symbolizes something about the history of nursing at that school, or one of the values that that school holds dear. The Mercy College of Health Sciences pin is shaped as a circle symbolizing eternity. This self-contained logo embodies the school's holistic approach to health sciences. The Mercy College of Health Sciences purple color flanks the logo mark on either side, while the green symbolizes life and tradition. The white stands for purity and integrity. Reminiscent of a stained glass window, this logo also brings to mind a set of doors in a hallway leading to more doors. In other words, it represents a wide variety of possibilities and opportunities for you. The Mercy Cross is the centerpiece of the pin. The cross, of course, is the universal symbol of Christianity and service to God. It symbolizes that Christ is the great healer who came to relieve this suffering. It also recognizes the Catholic heritage and the Sisters of Mercy, who were founders of Mercy Hospital in Des Moines, today known as Mercy One Medical Center. As you receive your pin today, and as you wear it throughout your career, or like me, just see it in your jewelry box every so often, think what it means to be a Mercy nurse. It means you received a high-quality, values-based education. Every day, you demonstrate the definition of professional nurse in the work setting or in the community. Those who graduated before you expect you to continue the standards of what it means to be a Mercy nurse. And those who will graduate after you will look to you as a role model of professional nursing. Nursing pins and the pinning ceremony are time-honored experiences every registered nurse deserves to enjoy. You worked hard. Enjoy this moment and wear this pin proudly. Congratulations. And now I'd like to invite Dr. Krista Steffens to the podium for the reading of names.
Good evening. As I call your name, if you'll come up on the left side of the stage and walk across to have your pin placed by Dr. Williard and Dr. Ballou. Maida Optic. Christina Akins. Cynthia Ashuta. Michaela Askren. Isabella Bacon. Sarah Banwart. Amy Bidwell. Laura Blumenrader. Ashton Bloom. Heather Brody. Jacqueline Brooklander. Elizabeth Buckingham. Dallas Katie. Mackenzie Kearney. Shriver Kaluzzi. Ellen Corey. Leah Davey. It happens. Alexandra Dirks. Taylor Edwards. Marnie Yukin. Brittany Fenschel. Kelsey Ferentine. Stacy Fisher. Savannah Harbach. Joshua Helm. Rachel Harrington. Hannah Hesse. Jasmine Jackson. John Kerr. Leontine Krakuni. Jenna Lundy. Rachel Malley. Madison Mann. Chastity Marquez. Madison Morris. Laura Mukum. Chelsea Natung. Amanda Phillips. Braulio Pinto. Lucas Beach. Sydney Rosh. Christina Rhodes. Aubrey Richards. Lauren Roach. Destiny Rommel. Cody Seville. Victoria Shoth. Madison Searcy. Madison Slobodnik. Lisette Songby. Christina Soriano. Iona Sorinka. Michael Thomas. Caitlin Thomason. Samantha Tiedemann. Tiffany Tingle. Madison Zeman. Lindy Zumbraden, excuse me. Dr. Melissa Ballou will be reciting the Nightingale Pledge with the graduates.
You guys deserve that. All right, a little history about Florence. In 1912, the Florence Nightingale Medal was established by the International Red Cross to reward nurses who have distinguished themselves in an exceptional manner by great devotion to their patients in a time of war or peace. Will our graduates, nursing faculty, and any nurses in the audience please stand and join me in reciting the Nightingale Pledge. It's located on the back of the program. I solemnly pledge myself before God and in the presence of this assembly to faithfully practice my profession of nursing. I will do all in my power to make and maintain the highest standards and practices of my profession. I will hold in confidence all personal matters committed to my keeping in the practice of my calling. I will assist the physician in his or her works and will devote myself to the welfare of my patients, my family, and my community. I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and welfare of the community. I will constantly endeavor to increase my knowledge and skills in nursing and to use them wisely. I will zealously seek to nurse those who are ill, wherever they may be and whenever they are in need. I will be active in assisting others in safeguarding and promoting the health and happiness of mankind. Thank you. And now, Carrie Hollerud will be introducing the Daisy Awards.
Thank you, Dr. Blue. So this is our first time that we're presenting the Daisy Award for both our faculty and students. So just some history on it. The Daisy Foundation was established in 1999 by members of the family of Patrick Barnes. He was 33 years old and died of complications of the autoimmune disease ITP. Like many families that go through this kind of horrific loss, the Barnes family wanted to do something positive to honor the very special man Patrick was. So right after Pat's death, they came up with the DAISY, an acronym for diseases attacking the immune system. As they brainstormed that the DAISY Foundation would actually do, they kept coming back to one positive thing they held onto during Pat's 8-week illness, the extraordinary care he and they received from Pat's nurses. The family was very impressed by the clinical care Pat's nurses provided, but what really overwhelmed them was the compassion and kindness that his nurses brought to Pat's bedside day in and day out. Pat's family created the DAISY Award for extraordinary nurses to honor nurses who go above and beyond and make extraordinary differences in patients' and families' lives. There are other ways that the foundation says thank you to nurses, including honoring nursing faculty who instruct and inspire nursing students. Nursing faculty has a profound impact on the future practice of their nurses. Many nurses talk about hearing an instructor's voice in their ears even years after they have graduated. The DAISY Award for Extraordinary Nursing Faculty provides national recognition and appreciation to nursing faculty for their commitment and inspirational influence on their students. We are very proud to partner with DAISY as we have extraordinary nursing faculty here at Mercy College of Health Sciences. Now we will be recognizing all faculty who have been nominated for this award. Faculty, if you can please stand and come up to this stage. Hallie Hadke, Melissa Blue, Carla Kirkove, Catherine Sinclair, Ashley Hoff, Brandy Strawn, and Nikki Lafrette. Please come up to the stage. Congratulations. Congratulations to you all. You have gone above and beyond what it means to be an exceptional nursing faculty member. Now I will be reading the nomination that has led the award winner selection. This faculty member was nominated 3 separate times by 3 separate people. The list is so extensive. The faculty member operates with such an abundance of passion, inspiration is a guarantee. They take time to answer questions, teach effectively, and never makes you feel uncomfortable for anything that you ask help for. They hold us all to a fiercely high standard, but in a way that makes their expectations achievable and directly related to growing as future nurses. They spend extra time after hours answering questions, discussing the profession, and ultimately mentoring us. They are smart, friendly, approachable, and models everything I hope to be someday as a nurse. Their style of teaching is dynamic, thoughtful, and effective. They are so great at giving us room to learn through doing while creating a safe environment when we need help or make mistakes. They are most definitely a top educator at Mercy. This instructor is patient and encouraging with various clinical checkoffs. They are willing to explain procedures and is always encouraging. They take the time to care for patients, uses comforting and therapeutic communication, is kind with patients and the patients' families. They were our second clinical instructor, and we loved them. They created a wonderful learning atmosphere where we could all answer any questions that may be answered without being demeaned or berated. They made nursing seem possible and even fun. Without further ado, it is my honor to award Nikki Lafrette with the Daisy Award for Extraordinary Nursing. Congratulations, Nikki. When Patrick was in the hospital, his stepmother, Bonnie, noticed the great tradition nurses have for the pins, and they created this award pin for you to wear. We hope you will wear your Daisy pin proudly. Okay. The foundation also wants you to have this sculpture as a symbol of our recognition today. It is called a healer's touch. Each piece is hand carved by the artists of Shona tribe in Zimbabwe. The Daisy Foundation chose this beautiful design not only because it sensitively depicts the unique relationship nurses have with their patients and teachers have with their students, but also because the Shona people hold their healers in a positive of great importance to the community and feel about their traditional healers the way the Daisy Foundation feels about nurses and those who educate them. They are treasures to their community. I want to give a special thank you to the students, Rich Rosendahl, Carrie Stripling, and Adam Vincent, who all nominated our recipient today. This award doesn't happen unless you take the time to write the nomination, and it means a great deal that you care enough about Nikki to do this. Congratulations, Nikki. Now, once staff get back to their seats, I will read the award for the student. So the Daisy Award for Extraordinary Nursing Students is designed to remind students, even on our toughest days in nursing school, why you want to be a nurse. We are very proud to partner with the Daisy as we have extraordinary nursing students here at Mercy College of Health Sciences. Now it is time to recognize the students who have been nominated for this prestigious award. When your name is read, please come to the stage. Chastity Marquez, Destiny Rommel, Caitlin Thomason, Mackenzie Carney, Madison Searcy, and Tiffany Tingle. Congratulations. Congratulations to you all. You have shown your peers, patients, family, and faculty that what it takes to be an exceptional nursing student. I will now be reading the nomination of this student that has won today. As someone who has had numerous clinical experiences with this student, I am beyond certain that they will be an amazing addition to the nursing practice. They are able to make connections with patients on a meaningful level by the way they are able to use therapeutic communication so gracefully. It is clear to see that the way they speak with their patients greatly enhances their level of care and helps ease any anxieties. This student is also a valuable team player who is willing to help others with other tasks, questions, and provide an overall encouragement to other peers. It is my pleasure to award Madison Searcy with the Daisy Award. Congratulations, Madison. So again, when Patrick was in the hospital, his stepmother Bonnie noticed the great tradition nurses have for pins. They created the Daisy pin for you to wear. We hope you wear your Daisy pin proud. The foundation also wants you to have this sculpture as a symbol of your recognition today. It is called a healer's touch. Each piece is hand carved by the artists of the Shona tribe in Zimbabwe. The Daisy Foundation chose this beautiful design not only because it sensitively depicts the unique relationship nurses have with their patients and patients and teachers have with their students, but also because the Shauna people hold their healers in a position of great importance to the community and feel about their traditional healers the way the Daisy Foundation feels about nurses and those who educate them. They are treasures to the community. In closing, I want to give a special thank you to the fellow student and fellow nominee, Mackenzie Carney, who nominated our recipient today. The award doesn't happen unless you take the time to write the nomination, and it means a great deal that you care enough about Madison to do this. Thank you. Dr. Villiard.
As we come to the close of our ceremony today, let me leave you with a quote from Friedrich Nietzsche. The end of a melody is not its goal, but nonetheless, had the melody not reached its end, it would not have reached its goal either. You, our future nurses, are the melody, and you have reached your goal with us here at Mercy College. Let your life not be one melody, but a symphony full of tempos set in allegro and also set in grave, and everything in between. Let this melody be a springboard into your next musical piece. As always, don't forget to breathe. Friends, family, and loved ones, I would now like to present to you Mercy College's Spring 2022 graduating nursing class. May God bless and keep you all. Thank you all for coming. I know we don't have a ton of time in between now and the commencement, so please feel free to get a snack or drink, and also